Diabetic amputation. Considerations in a diabetic amputation. Unfortunately, not all limbs that exhibit diabetic foot infections or ulcerations are able to be salvaged. There are instances where amputation of a toe, foot, or below-knee amputation is actually in the patient's best interest. Best interest can include saving their life. There is a multitude of considerations that must be addressed in the decision of a diabetic amputation. The situation will vary from patient to patient. Different amputation levels offer different advantages and disadvantages. Considerations include the ability of the wound to heal. The level of diabetic amputation chosen must give the patient the best chance of healing, otherwise, the patient is once again looking at a chronic wound that requires regular ongoing medical care with the inability of the patient to get on with their life. Perhaps worse than that, it sets the patient up for possible further amputations at a higher level. In patients with osteomyelitis, the amputation needs to be far enough away from the infected bone in order to avoid a new bone infection. The patient's vascular status, circulation, must be assessed. If the level of anticipated diabetic amputation does not exhibit adequate blood flow, then the proposed procedure is doomed to failure before it begins. The overall health of the patient and a return to a somewhat normal life need to be addressed. A sedentary patient will place far less demands on the amputated limb than the reasonably young individual who would like to return to their normal activity level, which usually includes participation in athletic activities. Diabetic foot amputation. An example of this would be a diabetic amputation at the midtarsal level of the foot, mid-portion of foot. With this type of amputation, the individual will lose their ability to push off their foot. This loss of propulsive power then forces them to compensate by swinging their leg forward using their hip flexor muscles. This weakened gait cycle would preclude people from doing things such as running. Even though in this case the psychological and cosmetic factors would suggest a lesser amputation, the desired lifestyle the patient hopes to resume would necessitate a more aggressive amputation in an effort to construct a prosthesis to allow the patient to resume his or her activity level. In this scenario, the patient's vision of the future outweighs the medical criteria in terms of what level to do an amputation. On the other end of the spectrum is the patient facing an amputation who is more sickly. Not only do they have a foot wound or infection that shows no signs of healing, but their overall health status is also a concern. These types of patients are usually poorly controlled diabetics. They also in many cases exhibit heart disease and kidney disease. Many will have nutritional deficiencies. Many people with chronic foot wounds have been dealing with this problem for months if not years. They are seen constantly in wound care centers, occasionally hospitalized with infections and other diabetic-related problems. The longer a wound is open with the inability to close it, the greater the chances it will never close. A chronic open wound is always susceptible to infection. If the blood sugars are always elevated, the chance of infection and the inability to eradicate the infection also increases. Offloading or reducing pressure on the wounded foot puts greater demands on the unaffected foot. This in many instances will cause eventual breakdown somewhere on the good foot, and now the problem has doubled. For this reason, many patients reach a tipping point where they are better off with an amputation rather than an endless schedule of doctor's appointments and wound care treatment at home. I think it is fairly safe to say that given the choice, no one would like an amputation of their limb. However, there are instances where there is no choice. A septic, infected foot can lead to death. In the less severe scenarios, people in discussion with their doctor should arrive at a realistic decision as to what measures will allow them to get back to the type of lifestyle they envision for themselves. As you can see from this discussion, there is no cookie-cutter formula. Read the full article at www.foot-explained.com/diabetic_amputation.html